What was the impetus for putting all this together, for community healthcare, putting all
Great
this
question.
together?
We sat down about 15 months ago with a cadre of about 400 of our leaders within our organization and about 100 physicians, so 500 people. And we had that group agree to set up a function whereby they would go to and evaluate all the leading systems. And through that process, they came out with a solution that said, either do this through the system we've selected or don't do it at all. And so with that, it made my decision pretty easy. Then from that, we've organized leadership that includes leadership throughout the whole ranks of the organization, but once again, a lot of physicians. And we have physicians that have given up part of their time, half their schedules, to help lead this project. Because when it's all said and done, this can't be an IT project. This is about delivering care. So the idea is that get the caregivers involved, help them find the solution, support them, and therefore we'll end up with a better product.
Was there a model in another city, perhaps, or is this you kind of breaking the mold here?
There's this is models in other cities. I mean, there's other integrated systems throughout the country, and so we've tried to learn from them as well.
And so this is essentially, this is for the patient. This is to simplify their lives, essentially, it sounds like, especially with the registration part, because that's, having to register at multiple physicians, that's a pain.
I tell everybody, we're in a business, healthcare, that we are all patients. We know exactly what the issues are. None of us likes to have to show our card 5 times, or give the same information, or the same history and physical, or carry our drug list. So this is everybody come together, and I try to say, everybody get in your chair as everybody I've ever met is either a patient or a family member of a patient. So put that hat on, and let's design a system that meets the needs of us on that side of the table. That's what we're trying to do.
It's a major investment for you, too, as you pointed out earlier. How much is the investment?
The investment all in is about $120 million. It's a huge investment.
Does this save community over the long run, though?
We believe it does.
Yeah, okay.
We believe it not only saves community, but more importantly, it's better care. I mean, coordinated care is better care. And Dr. Yaletti was talking about in the press conference, we've all had situations whereby you go to the doctor, they tell you what you need to do, hand you all these orders and scripts and everything else, and now it's your responsibility. That's wrong. The responsibility is on the wrong side. You ought to leave there with your appointment set, your prescriptions are at the pharmacy, you know if you need to have a follow-up, where it's going to be. If they're going to send you in another place for treatment, they know you're coming, and that's all scheduled at that point in time. So it's trying to flip that to make sure that this is done from a patient's perspective.
How much, if anything, does this have to do with the changing face of healthcare, perhaps from a legislative standpoint? I mean, we're still in the midst of the Affordable Care Act. We don't know whether that's going to happen or not. But how much of this had anything to do with that?
Another very good question. The Affordable Care Act, there are people that are for or against it. And there's good parts and there's bad parts. What it gave us was a sense of urgency and a deadline. So one of the deadlines we need to have our systems orchestrated. And so it gave us an impetus to prioritize this as something we need to do. Who knows what's going to happen with the act? That's somebody outside of our control. But it's forced us to have a sense of urgency to take this action.
And the system is up and running now?
The system will go live in our first ambulatory sites next week.
Okay.
And then from there, it'll be kind of a tidal wave throughout the rest of our network over the course of the next roughly 11 months.
You think this is the future for the rest of the healthcare industry?
And it's good. It really is. It's good for everybody, because even if you go between systems or you go between cities, we have people up here who do things like spend the winters in Florida. They should have the same record. That information ought to be flowing, and this is a start to get that done.